Okay, let's talk about something that affects millions of people, but, well, we just don't talk about it, do we? It's usually something we whisper about, if we mention it at all. It can be uncomfortable, worrying, and honestly, kind of lonely. But today, we're going to pull back the curtain and get some real clarity on hemorrhoids.
You know that moment, that jolt of alarm when you see a flash of bright red and your mind just starts racing? It's probably the #1 symptom that sends people frantically searching for answers, and it's the perfect place for us to start.
And here it is, maybe the single most surprising thing you'll hear today. Hemorrhoids aren't some kind of disease or a defect. Nope, they are a completely normal, even useful part of your body's design. Exactly. The best way to think of them as vascular cushions. Pretty much all of us have them. Their job is to protect the anal canal and, help keep everything sealed tight. The problem, what we call hemorrhoidal disease, only starts when these normal cushions get swollen or inflamed.
So now that we're clear on what they are, let's get into the details. Because not all hemorrhoids are the same. They really fall into two main camps, and it all comes down to one simple thing: location, location, location.
Now take a look at this diagram. You see that little landmark called the dentate line? That is the great divider. Anything that forms above this line is an internal hemorrhoid. Anything below it is an external one. And believe me, where it's located changes absolutely everything about how it feels.
And this chart really nails down why that line is so critical. Up above it, inside the rectum, there just aren't many pain-sensing nerves. That's why internal hemorrhoids are usually painless. You might not even know you have one until you see that bleeding. But below that line, oh yeah, the skin is full of nerves, which is why external ones can be so darn painful.
Okay, let's zoom in on those internal hemorrhoids for a second. They're not just a yes or no thing. They can actually progress. Doctors have a system for classifying them into 4 different grades based on something called prolapse, which is just a fancy word for how far they stick out.
It all starts at grade 1, where it just stays inside. No big deal. Then you get to grade 2, where it might pop out a bit when you have a bowel movement, but it pops right back in by itself. With grade 3, it comes out and stays out until you manually push it back in. And then there's grade 4, which is when it's permanently out and can't be pushed back. Understanding this progression is so important for figuring out what to do next.
And this image gives you an idea of what that grade 4 situation can look like. At this stage, things can get pretty serious. The risk for complications goes way up. We're talking about things like the blood supply getting cut off or a really painful blood clot forming inside.
So if we all have these cushions, what makes them act up? Well, it pretty much boils down to one single word: pressure. Anything that puts extra pressure on that specific area of your body can lead to problems. And here are the usual suspects. Straining on the toilet is the big one. But you've also got things like chronic constipation or diarrhea, sitting for too long, especially on the toilet, the physical pressure of pregnancy, and even just the fact that our tissues get a little weaker as we get older. The upside? A lot of these things are tied to our lifestyle.
Okay, we've talked about the what, the where, and the why. Now for the best part, the how. As in, how do you find relief? And the good news is, the journey to feeling better often starts with really simple things you can do at home. For a lot of people, especially with grade 1 or 2, these changes can be a total game changer. More fiber, more water, that softens everything up, which means less straining. And a warm bath, sometimes called a sitz bath, can be incredibly soothing. It's all about breaking that cycle of pressure.
But what if the lifestyle tweaks just aren't cutting it? For those more stubborn cases, especially grades 2 and 3, medicine has come up with some really great, minimally invasive procedures that can be done right in a doctor's office. 2 of the most popular options are rubber band ligation and laser procedures. Now, I know they sound a little intense, but the ideas are actually super simple. With ligation, a tiny rubber band cuts off the blood supply, and the hemorrhoid just withers away. With the laser, a probe uses energy to shrink the tissue from the inside. Both work great for those middle-grade issues.
So what's it actually like to go through one of these? Well, to get a really clear idea, let's look at some data from a study on that laser procedure, HEALP. The numbers themselves tell a pretty amazing story about the recovery.
Okay, get this. On a pain scale from 0 to 10, where 10 is the worst pain you can imagine, the average pain score 3 days after the procedure was 0.176. That is incredibly low. For most people, that means the recovery is practically painless.
And it gets better. What about getting back to your life? On average, patients were back to their normal daily routines in just 2 days. So think about that. A virtually painless procedure and you're back on your feet in 48 hours. That is a massive deal for anyone who's been suffering.
Now, we've covered a ton of ground, but I've saved the single most critical piece of information for last. This is the one thing, if you remember nothing else, that you absolutely need to take to heart.
It's such a common thought, isn't it? You see a symptom, you jump on Google, and you figure, hey, it's got to be the most common thing. But when it comes to rectal bleeding, making that assumption can be really, really dangerous.
And this isn't just me giving you friendly advice. This is a direct quote from our source material, and it's a hard and fast rule in medicine. The symptoms of hemorrhoids can be a perfect imitation of other, much more serious conditions.
Look, your symptoms might just be a simple hemorrhoid, but they could also be an anal fissure, a fistula, an abscess, and in a worst-case scenario, they could be a sign of inflammatory bowel disease or even rectum cancer. There are real cases out there where something someone thought was a hemorrhoid turned out to be a tumor.
So here's the bottom line. You just can't put a price on peace of mind. Getting checked out by a professional is the only way to know what's really going on, get the right treatment, and, most importantly, rule out anything serious.
And that really leaves us with one last big question to think about. We know this topic is wrapped up in embarrassment and it stops people from getting help. So just imagine for a second, what if we could talk about common things like this openly, without feeling ashamed? How many of us might get diagnosed sooner, suffer less, and just take better care of ourselves?